Hi, I'm Dr. Gail Andrew, pediatrician, Medical Director of the Fetal Alcohol Spectrum Disorder Clinical Services at the Glenrose Rehabilitation Hospital in Edmonton. As well, I provide consultation to rural and community-based clinics. I'd like to invite all of the physicians in Alberta to be part of the solution to the complex problem of FASD. Alberta is recognized as a leader in FASD assessment, intervention, and prevention. I'll provide you with some background information on FASD and how to use the 760.71 indicator code in your billing. Prenatal exposure to alcohol can lead to brain damage to the developing fetus, the extent being dependent on many factors, including timing, amount, and pattern and frequency of alcohol exposure, vulnerable periods in fetal development, genetic and epigenetic factors, maternal stress, and nutrition. FASD is characterized by physical defects, learning deficits, difficulties in emotional behavior regulation, impairment in core brain functions such as planning, flexible thinking, judgment, inhibition, and functional communication, and ultimately maladaptation. And this leads to the inability to function independently across the lifespan. The diagnosis of FASD requires a multidisciplinary team approach to assess for the functional deficits and to rule in or out other conditions. The diagnosis of FASD needs to lead to supports and services using a strengths-based model for both the individual living with FASD and their caregivers. FASD is common, 1 in 100 in the general population, with an estimate that 36,000 Albertans are currently living with FASD, but this is a vast underestimate due to lack of diagnostic capacity and underreporting. FASD is highly overrepresented in the child welfare system and the justice systems for many complex reasons. FASD is expensive, costing $1.8 million in the lifetime cost across many systems of care, including health, mental health and addictions, education, social services, justice, and so on. And this does not include the loss of potential of that person and also their caregiver burden. FASD is theoretically preventable by no alcohol use in pregnancy, but this is a very complex problem and rooted in the biopsychosocial determinants of health. Individuals living with FASD are at risk for repeated failures and frustrations, and possibly leading to secondary disabilities if they are not diagnosed and provided with lifelong supports. As physicians, we have a key role in all of these areas. FASD needs to be part of a public health policy, as it is everyone's problem. At this point, there are no validated biomarkers other than confirmed prenatal history of alcohol exposure. To better understand the scope of FASD in Alberta, on May 1st, 2013, Alberta Health introduced a 5th digit to the physician diagnostic billing codes that are required for the physician compensation along with the healthcare service code. In the ICD-9, 760.7 identifies noxious influences affecting the fetus via placenta or breast milk. Adding the 5th digit will allow identification of the substance to which the fetus was exposed, with 760.71 for alcohol. For further information, see www.alberta.health.ca/professionals/fees or call toll-free 310-0000. Physicians are encouraged to use this 5th digit code if their patient has a confirmed diagnosis of FASD completed by a multidisciplinary team, or if there's confirmed prenatal alcohol exposure but individual not as yet diagnosed with FASD. The physician will need to use the 760.71 as the second diagnostic code that can be entered. The first code should be the reason for the visit and healthcare utilization in this population. This can be 314.2 for the management of the frequent comorbid diagnosis in FASD of attention deficit hyperactivity disorder, which occurs in 65 to 90% of individuals with FASD. The first code could also be for a medical condition or management, for example, of asthma 493.1 or minor trauma or other medical condition not necessarily linked to the FASD condition. The first code will also enable the healthcare provider to use mental health codes to apply to extender billing and not interfere with just remuneration in dealing with complex mental health impairment. Individuals with FASD have complex physical and mental health issues related to their primary diagnosis of FASD or to secondary disabilities from environmental circumstances, and all those issues need to be captured in the multiple diagnostic codes. This needs to be tracked in the data collected. Physicians hold the key to entering this data. Although physicians will not receive extra compensation to enter the 760.71 into their billing information, the 30 seconds or less time that it takes the physician or billing clerk to do this activity of entering it will contribute extremely valuable information. This code can be tracked and inform Alberta Health, not only identifying the number of Albertans currently living with FASD, but also the burden to the health and mental health systems because of their physical and mental health conditions. This information will advise and provide necessary planning information around lifespan services and supports needed for those living with FASD. Advocacy can be based on this data so that we can close identified gaps and develop responsive and coordinated services. Services that patients can access will indirectly help physicians provide the best standard of care for their patients. At this point, you may be wondering how you can access services for FASD and navigate what seems to be a complex system of care. We're very fortunate in Alberta that we have 12 service networks across the province, one of which includes all the Métis settlements. The networks provide local access to a wide variety of services, including FASD diagnostic assessments, and so on. Physicians can connect with their local FASD support network simply by going online to fasd.alberta.ca or calling 1-877-644-9992 to be linked to the network in their area. The network coordinators are extremely helpful and knowledgeable about their community and can help with many of the questions that you have. For example, where can we receive services for diagnosis and assessment of FASD? What are the local supports and resources for women drinking in pregnancy? Where can I get education and awareness resources regarding FASD in my local community? Are there respite services and other supports available for caregivers? What do individuals with FASD need from other systems beyond the health system to ensure their safe participation in their community, such as educational services, supports, housing, support employment, justice, and so on? I encourage you to connect with the network coordinator in your area. And by developing this type of partnership, you will actually have reduction in your workload and ensure that your patients will get the services they need. I'm hoping that all physicians will be able to incorporate that into their second billing code, 760.71. And by doing so, you will make a major difference in how we better support FASD across the lifespan. Thank you again.